It's a pleasure. I'm here with Agnes Berman-Pivnik, who is a marketing manager at Q Medical Devices. Agnes, I wonder, a global company that produces OEM products for emergency room and clinical care, line of products both for elective surgery but also for the emergency care. How the pandemic, COVID-19, meets your company?
So way back in March, we have received, like all the medical device manufacturers, this increasing demand, very, very dramatic demand increase in our critical care products. We are manufacturing the bread and the butter for the ICU units and emergency units for patient monitoring and measuring the vital signs of critical ill patients. And we have received this increasing demand. We could see over the days how the demand peaks in the critical care area and how the demand just flows down and almost stops in the cardiovascular area.
So here's a challenge. You have production facilities all around the world. You have factories, both in Israel but elsewhere. And at one point of time, you have to take decisions about how to prioritize production.
We are having a critical team, a critical crisis team that looks over the life cycle of the product from its beginning to the end, through the supply chain and the operational modus. So first of all, we had to work with our suppliers. It is critical for our operations to have a very strong basis of raw materials and components. And here we have gapped this demand by working with each of the suppliers. In some cases, we have 2 suppliers, so we were able to gap this demand. And then when we bring them into the production, we had to map our production facilities. And to add another dimension was the fact that some of our facilities were a total lockdown. Like, for example, in India, from one day to the other, we have seen a facility that numbers 1,000 people that it's closed. The borders are closed. So we had to deal with shifting of production in different other areas in Israel, where we have 2 facilities, in Slovakia and France, and to see how this can be performed without breaching the regulatory and the quality restrictions that we have with the product.
So here, Agnes, the challenge. We know that in medical devices, you plan ahead of time. You have a very detailed planning for years in the production facilities, which need also to meet quality assurance and regulatory burdens. How flexible is the regulator in changing production lines? How flexible is actually the quality control when you shift from production of one device in the factory to another device?
Actually, it is not so simple. We need to, in order to be able to do major changes, we need to do the validations of the products from the beginning for the same processes. But if we use the same process, the same machinery to manufacture 2 types of product, then it is possible. So total shifting of production is enabled only after we have the product validation and we ensure that the quality of the product is the same as the original manufacturing.
Were regulators more flexible at this time for changing line of products?
We haven't seen this. Unfortunately, the regulation, it was still standing on. We haven't seen any changes in the regulation, and we don't have to supply all the changes. We have to have them inside. So,
Agnes, another challenge, you're a global company. You're supplying the demand in so many countries around the world, and countries are competing with each other for access to medical devices. We've seen stories where companies are holding actually products or controlling the export of products which seem vital. How a global company with demand all around the world manages this kind of like macro world economics at a time of crisis?
First of all, we have calls and we have continuous communication with our customers. We have set up this once a week meetings with all our major customers and with the hospitals in Israel, which was one of our challenges and our goals to provide continuous delivery in the hospitals in Israel. And what we are doing after the demand is reviewed in a weekly basis, we are going back to the planners, to our industrial engineers, and we are managing the production with a tweezer. It was a very, very challenging situation, and we understand that for a company to be able to succeed and to produce these products, we need to be flexible. The new normal situation is the constant changes. So we are in this situation where we understand that changes will happen and we will have to give them solutions.
Thank you very much, Agnes. It's a pleasure to understand a little bit the dynamic of production and manufacturing at a time of crisis. Thank you very much.
Thank you for having me.